Thanks for joining us here at the Canadian Pharmacists Conference 2016, jointly hosted by CPHA and RXA. From a great debate focused on the issues, challenges, and opportunities facing the profession, to an out-of-this-world keynote address, to over 50 CE sessions covering innovative practices, research, business, and more, the future was here in Calgary, Alberta. Take a look.
Will directly participate in identifying.
Being at this type of forum has truly, in my heart and soul, inspired me. I think what it has done is reinforced that it is okay to take risks.
Pharmacists, if that changes.
I think it was a great addition to the conference, mainly because we have to have these conversations. And what I find when we come to conferences like this, those conversations occur in the hallways. The strength of this is that it occurred amongst all of us.
There's so many great exhibitors here, and it's so nice to see what's out there in the market right now.
It's great to see all the technology and all the neat and cool things that are coming out, and it makes me excited for my own practice and how I can harness all these new things that are coming out and what the future really holds for the profession.
I think it's been really exceptional. It's really lovely to have vendors from across the nation all in one place so that we can really learn about the different products that they offer, but also the pharmacy support programs that they have in place, because often the education that they provide is just as valuable as the product.
If you look at this map in front of us here, you go from Victoria to Halifax in 10 minutes.
I think that it was a fantastic presentation. It really ties in with where we're going in pharmacy, the future, not being afraid of the unknown. It was really great.
It's already a complicated business, and I hear over and over again from pharmacists in hospital and community practice that they can't keep abreast of the topic. I think we're going to have to rely a lot more on technology, real-time sort of access to information, but the role of the pharmacist can't be overstated.
Taking the courses like becoming a CRE, so Certified Respiratory Educator, Certified Tobacco Educator, getting that spirometry, getting that advanced education and having the pharmacists actually doing it in the pharmacies, I think is going to build the capacity for us to be able to do more testing than just sending to the physician's office.
This is important because it's an area that we all know is very common in our patients. We have lots of patients that are on antihypertensive therapy, and we also have a lot of patients who are on therapy but are not adequately controlled. So there really is a very clear role for the pharmacist to play in improving hypertension outcomes for our patients.
It's so important. I feel very privileged and honored to be receiving this award. It's such a reflection of my whole career. It's a reflection of how the things have evolved in the profession.
Engagement is the key thing for me. I really want to see pharmacists actually going out and talking to these patients, help them through these issues. We know with biologics, especially the TNF-alphas, which is one of the key parts of our talk today, one of the things is about a third of the patients are not adherent to their therapy. They're not taking it appropriately.
What we've been able to show is that when a pharmacist takes the responsibility, they prescribe, they identify patients who have the condition and follow along with them according to the national guidelines, that people get better outcomes.
It's good to see there was benefits overall because I hadn't really seen the results, and then to be able to pass it on to everybody, I feel proud.
The reason that we were interested in working on this topic was because of the risk of low blood sugar, particularly in the elderly, and the increased risk of falls that's associated with that.
We're really excited. Right now we're identifying about 1.4 drug therapy problems per patient after they get a genomic test, which I think is high and exciting.
The best thing pharmacists can do, I think, is, other than not starting people on opioids when they can prescribe codeine, for example, or advise codeine, is making sure people realize, especially when they start an opioid, or in people who are on long-term high-dose opioids, that there are some important safety concerns.
The best part of all the sessions, but especially in this one, is learning new resources that we can access to better our knowledge and better treat our patients in the end.
It was absolutely fabulous.
I was really fortunate to come here and learned a lot this year.
Really great information, great speakers, fun events, fun time.
I always love seeing the pharmacists that are doing just such innovative things in their practices and from all over the country.
Really good quality of speakers, lots of fun, lots of networking.
Just, gives you the hope that the profession is going in the right direction.
I think I'm hopeful for the profession, I'm hopeful for the future and all the great things that are going to come.
The Canadian Pharmacists Conference lets you learn, connect, and discover, all while having a lot of fun. Don't miss out on all the excitement next year. Plan to join us in Quebec City from June 2nd to 5th, 2017. See you there.